Good afternoon. Today we're here with Melissa Powell, the Chief Operating Officer of the Allure Group in New York City, New York. And before we get started, I have to tell you a little story because Melissa Powell hosts our events and our trainings, and we talk readily about the Ritz-Carlton and service delivery, especially with the regulations. And in the Ritz-Carlton, one of the methods is you never point, you always walk. So when I went into your building and I was speaking on the grade 8, I walked into this amazing facility in Brooklyn, New York, and I was warmly received by the receptionist, and instead of pointing to where the training room was, you had staff lined up to escort all the attendees up to the room. And it wasn't really that difficult. It was only up one floor in an elevator and to the right. You could easily have put signs, but it's that level of service that sets you apart. And again, not knowing the training or the education on that, but it's amazing. So I have to say that to the audience before we get going. And all right, so Melissa, how are you today?
Good, thank you.
Great, great. You have a vast amount of experience. We could talk about so many things today. But let's chisel it down and let's talk about CJR, Cardiac, and maybe some quality measure stuff. But tell us your experience, what's happening with your operations, and how's it going?
So I think CJR has been a positive thing for the short-term, long-term care arena. I think what it allows for, or what's blossomed from it, is real strong clinical data being analyzed in the proper way. People like myself at a C-level really questioning what's happening on the front lines. Are people getting better? How long is it taking them to get better? What are the barriers to getting them home quickly? Are we discharge planning from day one like we're supposed to be doing? And are we doing that not only from day one, but from pre-admission? And then in that process, are we partnering with our hospitals in order to do that? So I think what I've seen in Brooklyn come out through the partnerships is a strong relationship, not only at the executive level, but at the line level. My rehab directors are communicating with my nurse managers, and they're communicating with their counterparts in team meetings with the other hospitals. We have certain hospitals that we communicate with weekly about our patients that are part of bundling. We communicate about what barriers we've had to discharge planning this is a joint replacement and this patient should have been home in 10, 12, 14 days. Why are they here still 16, 18? Sometimes those things are out of our control. And we've learned from that the hospitals also need to help us with those expectations. A big piece has been, especially with the joints, that a lot of people are coming in for maybe a second knee. They did their first knee 2, 3, 4 years ago, and they stayed in a subacute for 20, 30, 100 days, depending on the subacute, right? And I think the lesson is really communicating with patients and families that expectation right off the bat of where healthcare is today.
Excellent. So you've had this exposure and you had this, experience with the comprehensive joint replacements. Now cardiac is on the table. So tell me a little bit, I know you've got experience with that, so tell us about cardiac and what do you anticipate? So
cardiac for my homes in particular is really a niche specialty. We're very proud of the work we do with cardiac. Our cardiac return to the hospital, those stats are next to nothing. It's amazing the work we're doing, and we have NPs on site and cardiac physicians on site, and there's a lot of special programming, niche programming done around that. And I think that the bundling of that particular cohort of patient is really going to lend the same kinds of positive outcomes to the facilities that maybe don't have the ability, don't have a large corporate structure helping them and guiding them. I think now some of those smaller operations across the country are really going to be able to look at best practices. Our company is published in best practices, and they'll be able to do some research and implement those things with the right guidance. And I think it will help the patient.
we as an industry are very interested in those best practices for cardiac, because that is an element that will, that those procedures and nuggets will help everyone escalate to the tasks that are going to be critical for success. So people will be looking for you for that as well.
The management of a cardiac patient is not easy. We had to increase levels of staff on the front lines, and we had to do immense amounts of education, and we had to bring in NP models and physician on-site models, at a 7-day-a-week clip, not just once a week. So I think that challenges our industry, and I think that it is expanding our industry, and it's only going to give us more of that stronghold and that preparation as the acute care hospitals are asked to send them to us more earlier.
Melissa Powell from Allure Health Group, thank you so much. We are interested in the nuggets for the cardiac program, the amount of staffing, and maybe there's an increase and a decrease, but thank you so much for coming, and we'll see you soon. Thank you. Thank you.